To this radar opus presentation. I am going to go over a very unique and what I consider satisfying case I had a couple of years back. And so let's get started. Um, this was a case of a 13-year-old who had a problem with bedwetting almost every night. So let's go over the objectives for this presentation. So we're going to do an overview of case taking. What is it that we're looking for when we're sitting down with somebody who's suffering? What's the intention? We're going to do some case analysis for this case specifically. We're going to repertorize using Radar Opus Adonis. I'm going to show you how to use the search function and how I use it when I'm trying to track down the exact rubric that exemplifies or is the epitome of the symptom, the sign of the symptom presenting in the case. It is so important to find the rubric that fits the symptom. You can't have variation. If you have variation, you're not going to get the right remedy. And then I'm going to touch on some Materia Medica by Gunavante, Didier Grand George. I'm going to touch on Murphy's Constitutions, which are useful. And then as a little added little bonus, I'm going to show you Margaret Tyler's different ways of finding the remedy. So there's just so much Materia Medica, so many repertories, so much information in Adonis, and this 1 hour we're going to spend is just going to highlight and showcase just a small amount of that. Okay, so the strategy of case taking. So it's really important to start wherever the patient or the parent of the patient would like to start, right? Typically, it's very superficial, and it's usually just glossing over symptoms, the kind of very brief medical history, and I'd say 90% of the time, there's nothing useful in the initial opening, the initial information that's gathered. But there can be opportunities, doors, right, that we knock on with questioning to kind of go deeper into the case. So the initial open-ended questions usually deal very little superficial, usually yield very superficial information, but will provide opportunities to ask questions that will take us deeper into the case. Investigate the particulars about the bedwetting in this case, right? Is it while the child is first sleeping, while the patient is first sleeping? Is it towards the morning? Are they dreaming of urinating when this happens, when the enuresis happens? It's a very good symptom if it does happen, and I would use it. Has it happened since a head injury, concussion? Is it happening around the full moon? Is it happening in conjunction with infestation of worms? We want to ask about the patterns of sleep, any issues around falling asleep while sleeping, sleep position, right? Leaving the windows open, laughing, weeping, talking in sleep. In my experience, talking in sleep is not very useful, but weeping and laughing are useful. What's the quality of the sleep? Is it a very deep comatose sleep? Is it a very light sleep where every little noise wakes them up? Are they twitching a lot during their sleep? Are they perspiring in their sleep? Do they have the feet out from the covers or the windows open? So we're really looking for information that's going to indicate the remedy, right? Investigate possible exciting causes or causation, like emotions, anger, vexation, indignation, excitement, anxiety, grief, fright, etc. Investigate the personality, the demeanor of the patient. Look for fears, cautiousness, heedless, or rambunctious. The relation with siblings, parents, strangers, peers, right? All of these, I'd say most of the time, these questions don't yield a lot of information that is useful for finding the remedy, right? 70, it's just a range, but 70 to 80% of the information that you gather in the intake is homeopathically useless because it's part of the human song. It's too human specific. So we disregard it. We focus on that 20%, sometimes one symptom, sometimes 3 symptoms that are really strange, peculiar, and will help guide us to the remedy. We look for sensitivities to food, to thirst, right? Strong food cravings, food aversions, child can't eat rich foods or fat from animals or milk causing diarrhea, just anything where the consumption of that food causes a physiologic response is relatively useful. Okay, and then through the whole process, stay open. Stay open to the universe. You want to call it the universe, God, the process, because the healer is not the doer or responsible for the healing, right? As practitioners, we put 100% into each patient. 100% of our patients don't get better. The ones that are meant to get better do. So what is our job? Our job is to go through the process, and we're to become diligent in this process of case taking, case analysis, materia medica, the art and science of homeopathy, and we leave the results up to a higher power. And then, as one of my teachers used to say, always look for the bit that doesn't fit. So let's get started. So this case was back in June of 23. Chief complaint, nocturnal enuresis, so bedwetting, and then these chronic lung infections with these frequent coughs that would last weeks to months at a time. So the father starts by explaining the situation, that bedwetting has been occurring his entire life, right? So obviously when he's a child or an infant, he's in diapers, you don't really know, but father says he never transitioned, always been wetting the bed, and it's most nights. So they went to see specialists, and the specialist recommended he stop drinking anything by 6:30 p.m., right? And then his pattern for sleeping is usually by 8:30 he's in bed. And they have to set an alarm and wake him up at 11:30, have him urinate, and then go back to bed. Even with all this, he still urinates almost every night. So during the day, he waits till the last second to urinate. He sleeps very deeply. This just so the case is a bit longer than this. I've just taken out information that's useful for teaching purposes. Um, it's almost impossible to wake him up to pee. So even when the alarm goes off, it's really difficult to wake him up. And then he urinates very large amounts in sleep. And then so the father gave me some more information. Then I ended up asking the patient things very superficial, right? He likes hockey, he likes swimming, squash, water polo, javelin. So he's very active. I asked about fears and phobias. He said heights. Then I asked about it, and there wasn't really it wasn't a fright. There wasn't enough energy there to use it. And it's fear of heights is connected to the chief complaint. So, however, if he was like, oh, I at the top of a ladder, I'm shaking, I can't go much higher than the fourth rung. That's a fear of heights. So we can incorporate that even though it's not associated with the chief complaint. But if you do have a fear or phobia that is associated with the chief complaint, very, very useful. In this case, it's not that useful. Then the father says he gets frequent lung infections. If he wets his hair, or he gets chilled or cold, he'll get a sinus infection that goes deep down into the lungs. So we're going to touch a little bit more on this, but any concomitants and modalities with the cough. So anytime you get a symptom, headache, PMS, cough, you try to get sensation if possible. And if it's, common sensation, burning, pulling pain, aching, burning and aching are the most common, so we don't really use those. Then we look for concomitants with the cough. Does he get a headache when he's coughing? Does he get throat pain? When he's coughing, do his eyes water? When he's coughing, does he get a headache? When he's coughing, does he pass urine? And in this case, he does. So it's very unusual for a 13-year-old to pass urine with cough. Not so unusual for somebody, a female that's had 3, 4, 5 children. Not unusual for people that are older in age, 50s, 60s, 70s, 80s. It's more I'm not going to say it's normal, but it's more usual to have people that have incontinence older in age or that have had multiple children. So then this persistent cough can last weeks to months at a time. And then so now we get into location. And so it's a spot in his lower lung that irritates him and triggers the cough. So we've got irritation as a possible sensation, and we've got a location in the lower lungs. That's a bit unusual because typically a cough is triggered by a sensation or pain or a dry spot or irritation in the trachea, the larynx, or the throat. Somewhere around here is usually what triggers the cough. So when we start getting symptoms that indicate that there's an irritation or a tickle or a crawling or a pain or something lower in the lungs, in the chest, that's triggering the cough, that's a bit more unusual in my experience. And then also when he's breathing out, expiration will trigger the cough or aggravate the cough. So we can use that. So in Germany, he sleeps on his back. The family's German. And with one blanket, even in the winter. And then the other thing I kind of got a sense was that initially the father kind of presented his son as this kind of mild, well-mannered young man. And so I listened, and okay, possibly that's true. But then as we talked a little bit further, we could see that he does have some issues with irritability, fretfulness, and we'll get into that a little bit more. So the dad says by nature he's very shy, he's very active, which we see in the sports that he likes to play. He loves reading. None of that really, it may point to the constitution or the temperament, but it's not connected to the chief complaint. So as far as weight in the case, I would give it a 3 out of 10, right? He doesn't like spicy foods. It's more of an aversion, not an aggravation from spicy food. Prefers salty foods. Again, connected to the chief complaint? No. Possibly useful? Possible. He's sensitive. He can annoy others and get triggered when in certain moods. So he does have a moodiness to him. Doesn't like when others are prioritized. Can get moody, get upset, and explode. And we talked about that, and it's more verbal. He can get upset and irritated easily. So I wouldn't really put him as um, shy or mild by nature. He can be shy, timid, and also be irritable. And then there's a sensitivity to music where he can cry easily from it. So that's an overview of the information that was given to me. There was more information, but most of it was completely unuseful. So then we go to the analysis. So what is important in the case? So one of the most unique things is that he sleeps so deeply he can barely be awakened, and almost impossible to awaken. So let's take a moment um, to find that. So what we're going to look for is difficult to awaken. And what we can do is we can look in the sleep chapter, and we can also look in the bladder chapter, because the bladder chapters we're going to have enuresis or involuntary urination. And then we'll just look for those. We'll look for that, this words in together, tandem. So we'll do a search. So essentially what I'm doing is I'm putting in the chapters I want to look in here. I don't have a remedy that I'm looking for, and I want to look in it for difficult. To awaken is difficult. So I want to make sure that's looking for both of these words together in the same paragraph or in the same rubric. If I do at least one of these, it's going to look for difficult and awaken separately, and you're going to get hundreds of rubrics that don't apply. So, and then we want to search in the repertoires. Just give it a second if it's searching. And then over here, if you're looking at your screen on the left, you've got Boger, Meglavori, Murphy, Schroyen. We're using Adonis today, so it's on Adonis. It's the blue box, the lined box. And so we've got bladder, involuntary at night, difficult to awaken the child. That's describing exactly what we're dealing with. So let's pull that up into the repertory. Falling asleep, difficult. After waking, no. Waking, difficult. We can put that in. And the other thing is we can put in, since we're in the sleep chapter, let me just go, I'm going to double click on this just to get me into the sleep chapter. I'm going to backspace, and sleep. He sleeps deep. There's 342 remedies there, so it's not very useful. But if the remedy should be in there because he's a very deep sleeper. So we can just put that in there. And then the other thing we wanted to look at, so I'm just going to type in, this is one of the things you can do with Radar Opus. So I'm going to type in bladder. And because this tab is open, synthesis, Adonis is open, when I type in bladder, it's going to go to the bladder chapter. I just typed in BLA, press enter, and then we're going to go to urination and down, pressing the down arrow, urination, involuntary, enter, at night, enter. There's in children. There's the rubric I was talking about, dreaming of while urinating. This isn't part of the case, but if it were, you see there's a Kunzli dot there. CP is there, sulfur is there with the Kunzli dot. So those are very strongly indicated remedies, but we can't forget there's equisetum, belladonna, creosote, lacaninum, uh, latrodectus, the brown recluse spider, lycopodium, in first sleep. This is a symptom I've actually found that's very difficult to determine because typically the child goes to sleep and then the parent doesn't check in with the child till morning, so they don't know. And what is the first sleep? First sleep is the first couple of hours. We're going to differentiate the remedy that I gave with another remedy that has um, enuresis towards morning. But what I'm trying to share with you is that differentiating whether it's the first sleep or at the beginning of sleep or towards the morning in practice is a bit difficult. All right, so let me just go back. So at night, difficult to wake the child. We use that rubric. And we could use in children, but I'm not going to use that right now. So let's just go back. So we have our rubrics that we're putting here. I want to go back. So very deep sleep, almost impossible to wake him to urinate. We've got that repertorized. Frequent lung infections. So we're going to go to Murphy and the Constitution. So there's a couple places to look where people get recurrent, and one of them is generals. Um, Personal history, it's history personal. Just clicking on that. I just clicked on history personal. Recurrent. Um, where are the complaints recurrent? Recurrent complaints, there it is. So this is one rubric that you can use if somebody has repeated ear infections, repeated sinus infections, repeated gastrointestinal complaints, anything that it's recurrent. You can use personal history recurrent. I wouldn't use this alone. I would take this and I would combine it with this one, paroxysmal. This is also in the generals, paroxysmal or recurrent complaints, and I would combine those two together. So this is something that we could use for this case. Just put that there. And what I would do in this case is I will combine the two rubrics. I'll show you how to do that in a bit. Oh, the lung infections and radar. So then the other thing we want to look up is we want to go to, so if there's a little down arrow here, I press on that. And I go to repertory version 3 Murphy. These are all the repertories I currently have open. You see, I've been very busy looking at different cases, looking through different repertories. There's a lot of overlap and repetition in these repertories, but then there are some that you have to look in that repertoire. That's why the search function is so important because it can get you to a rubric or a symptom that you're not going to find in one repertoire that you will find in another. So I just click on it and Murphy's opens up, and I actually had it open too. So delicate constitutions, sickly and easily innervated. So in this case, even though the child is this adolescent patient is very active, he does get sick frequently. Um, I think he's getting these coughs that last weeks to months, 2 to 3 times a year. So that shows that there's a weakness to his constitution. So I did use this particular rubric. I'm going to just go back to case analysis. So we touched on Murphy's constitutions. Let me just show you a little bit more about that. So constitutions, I'm just clicking there. There you go. So this is in Murphy's repertory. Constitutions, alcoholic constitutions, anemic constitutions, asthmatic, bilious constitutions with birthmarks, right? Delicate constitutions, we use that rubric. Are There's dwarfish, elderly, emaciated, lax fibers, rigid fibers, growing too fast, hypertensive constitutions. Some of these are smaller rubrics, and I don't know if I would commit to using them, but some of them are actually pretty good. Lack of reaction, scorbutic, scrofulous. So what you'd have to do for each of these, especially this older terminology, you'd have to go look these up. Like plethoric are people that they carry water, they can gain weight easily. Um, so that's what this is indicating. Um, but these are useful. Then you can go to temperaments as well. See what he has. There's nothing there. Clark has temperaments. Okay, Clark is a repertory here. I don't have it pulled up, but he has temperaments. Anyway, I just wanted to touch on this that so you're not necessarily going to find constitutions um, as in Adonis to the same degree that you'll find it in Murphy's. So Murphy's is useful that way. So we go back. Um, so if he wets his hair, he gets chilled or cold, he'll get the sinus infection that goes deep down into his lungs. So what I would do there, I'm just going to go back to Adonis here, and I go to generals, wet, getting wet aggravates. So this is getting wet. This is getting, if the person gets wet, it causes symptoms. So we can use this, and also if he gets cold. I'm just backspacing right now, and I'm typing cold, aggravates. The big rubric, 334 remedies. And this is for his cough, remember? So we've got the chronic bedwetting and the chronic cough. It recurs about 2 to 3 times a year. So let me just pull this back over. Let's put this rubric in. He passes urine when he coughs. Again, that's very unique for a 13-year-old. So again, we're going to look under, we just want to make sure this tab is open and active. And so we go to bladder. So I just typed in BLADD, enter. Urination, downspace, enter. It's not voluntary, so it's involuntary. Coughing during cough. So there's a Kunzli dot, and then you've got a bunch of remedies that are indicated with the Kunzli dot. The Kunzli dot is from Joost Kunzli, who found that if you have a symptom, so involuntary urination from coughing, if you have that symptom, he would put a Kunzli dot. He put a dot next to it saying this is a very clinically relevant, useful symptom. So we have it in this case. So chances are that the remedy that this patient needs is in this rubric. Okay. So we'll just add that there. And so there's a spot in his lower lung that irritates him and triggers the cough. So this is going to get us to the remedy because there's only one remedy that has this irritation that causes a cough from the lower lung. So cough from irritation. And again, remember what I said. Typically, I'd say over 90% of the time, the thing, it's very important in cough cases that you understand what's triggering the cough. Not necessarily when I drink or when I'm exposed to open air. Those are the modalities. But then the person says, when I go outside and I feel a tickle, the tickle is what makes me cough. So open air aggravates the cough, yes, but also there's a tickle and you have to differentiate. Is it the throat or is it the voice box, the larynx here? Okay, they're different. And so typically the trigger for the cough is somewhere here in the throat. And in this case, what he's feeling is an irritation or something deep in the lung, in the lower chest. So from irritation in the chest in the lower chest. So what I would do in this case in practice, because what I did was I looked in the chest from irritation in the chest. I used this rubric, right? But when I continued to study the case, that other rubric that I used, lower chest, actually came up. So we'll put that in there because we don't want to get pigeonholed into a small rubric right off the bat, um, unless it's really strong. Like in this particular case, the thing that prevented the child from going to the bathroom was that he was sleeping so deeply. And it was almost impossible. The dad said, "You can almost not wake him up. It takes so much because he's so in such a deep sleep. It's very, very difficult to wake him up." So, um, and then expiration will also trigger the cough. So we'll just go here. I'm just backspacing. Cough, expiration aggravates. So we can just use this as a good size rubric, 18 remedies. Then you always have to confirm, right? So when you breathe out, that's when you're coughing, right? Yes. Okay. Inspiration? Nope, totally fine in inspiration. Because sometimes coughs are aggravated from each inspiration. Sometimes the coughs are aggravated from inspiration from cold air. Sometimes it's inspiration and expiration. Sometimes it's trying to breathe deeply, right? That's its own rubric. Let me just show you that quickly as an aside. Let's see, breathing deeply, sorry. So breathing deep aggravates. That's its own rubric. There's a lot of remedies, 88 to be exact, in this repertory that breathing deeply will trigger. So that's different from inspiration. Inspiration is just the normal breath. Breathing deeply is trying to take a deep breath. So again, like I said in the beginning, we're always trying to get the most accurate, most precise rubric for the symptom. So expiration triggers, and then annoying others gets triggered when. So I did explore all this to try to see if there's anything strange or peculiar or unusual about the annoyance, about his irritability, and there wasn't really much there. Um, we consider irritability human specific, which means we all have the potential to be irritable. So there's nothing really relevant about it homeopathically, unless there's a sub rubric under mind irritability that would help us out. But there was a rubric for temperament. Let me just go to Clark. It's over. It was under Clark's clinical repertory. Temperament, irritable persons. Put that in there. And then it's sensitive to music and can cry easily. I'll put that in there as well. So we'll get out of Clark. Go back to back to Adonis. If you have any questions while I'm going through this, just let me know. Adonis, Shroyan, we'll go there. So that's under mind. So I can either click on this, which is the slow way, click on the binoculars, it gives me all the chapters, then I click on mind, and then I type in weeping, and then music. And then we have to differentiate, are they crying for music? Do they get sad for music? Because there's other rubrics, okay? In this case, he cries when there's music. Because there's also, there's sadness, music aggravates, and the music makes them more sad. There's music aggravates under the mind. This is also, so sometimes you have to combine these. Um, I think that's actually a pretty good practice, especially in the mind chapter. So I'll give you another example. So in this case, music affects his mind, so we can use music aggravates, and we'll combine this with weeping. Another example might be somebody before their menstrual cycle, their temperament changes, their mood changes. So we can also use menses before aggravates. So we can use this. This is premenstrual tension, female genitalia, premenstrual syndrome. So we can use that instead of using sadness before the menses, or weeping before the menses, or irritability before the menses. Um, and if you want to, you can just combine them. So let's just go here. I'm going to go to weeping for music, and music aggravates. I'm holding the command button down. I have a Mac, so I'm holding the command button down. And then I right click and I group or combine the rubrics. I click on that, and then you have to create a new symptom combining the remedies from the selected symptoms, from the selected rubrics, and then combine. And then so 44 and 53, you end up with 78 remedies when you combine the two. Okay. Let me see what else we had here. Sensitive to music, can easily cry from it. So we're going to the repertorization, which I'm doing as we were going through the case analysis. So when we look at the remedies that cover bladder urination involuntary at night, difficult to waken the child. 3 remedies, creosote, grade 3. Sleep, waking difficult, grade 1. Sleep deep, grade 3. Paroxysmal or recurrent complaints, creosote didn't come up there at all. Something else we could do is we could do a search for the word paroxysmal or recurrent and look for creosote to see if it comes up in any repertory or materia medica. Um, Getting wet aggravates, creosote is not there. Getting cold aggravates, creosote is there. It covers urination involuntary during cough, grade 2. And then cough from irritation low in the chest, cough from irritation in the chest, cough expiration, irritable persons, and music aggravates. So if we want to see creosote, what we do, I go to the search function, creosotum. Click on that, and then do you see how this circle is like a grayish blue? It's not active yet, so I have to press enter. Now it will search. If I don't press enter and this is still light blue, it won't search for the remedy. So um, let's look up involuntary urination. So I want to make sure that it's going to search for these 2 words together, not separately. And then we'll just look in all repertories. And the repertories will pop up over here on the left. Uh-oh. Let's see. Some sort of involuntary urination. 1 second. Which word? All repertories. Mm. Oh, I didn't spell involuntary right. We just do urination. So Shorian, Adonis, let me just open this up. Bladder, urination, dribbling perpendicular, urine drops out perpendicular. That's actually a good rubric to use. Frequent, there's involuntary. Here we go. This is what we wanted here. Involuntary urination at night. There's 190 remedies there. So it's good to see creosote's a grade 3, strongly indicated. And you see the different authors here. You've got Boninghausen, Bulger, Oscar Boricki, Kent, Roger Morris, and Fatak have all confirmed that creosote is a good remedy for bedwetting. Dreaming of urinating, we did not see that in this case. It's there though as a grade 2. For sleep, we don't know. Deep sleep at night from deep sleep. It's the only remedy. Boninghausen and Roger Morrison have confirmed that. And difficult to wake the child, again, grade 3. You have Norland, Fatak, um, I think that's for Mullen. Kent, urination involuntary during cough. We had that in the case. Um, Urination involuntary during sleep. So let's talk about that for a second. This is making an assumption. urination involuntary at night, they're making the assumption here that the patient is sleeping. Because when we click on it, bedwetting, enuresis nocturna. Okay? But we do differentiate at night versus sleep in the repertory. So this is an assumption that the patient's sleeping when they pee. And let's go back to the search function, urination at night, and then during sleep. We double click on that. So Farouk Master is differentiating. He's creating a different rubric, urination involuntary during sleep. Belladonna, creosote, pulsatilla, scrophanthus, paratrum. Ideally, I think the rubric should say urination involuntary sleep during, and all the remedies that are in the uh, urination at night should be here if that's what the inference is. Um, because people could be peeing involuntarily just at night, but be awake, right? So let me just see what else we have here. Creosote was the remedy that I gave, and I gave it based on the peculiarity about the cough and the irritation in the lung, and I gave it about because of the peculiarity about how deeply he slept, and that's what was preventing him from waking up. I mean, the fact that you have to set an alarm at night, and even with the alarm, the dad has to go in and wake him up. That shows how deeply he's sleeping. And that's what's strange, rare, and peculiar. I mean, 20 years of practice, and this is the first case I've seen with this particular reason as to why the bedwetting is occurring. And then the sensitivity to music as well. Interesting that creosote covers that. So we repertorize. And so creosote is a distillation of wood tar. So we would expect it to have some similarity to other remedies that we have from wood tar. So there could be some similarity to thuya. There could be some similarity to, what's the other remedy? It starts with a turpentine, terebinthina. That's the other remedy. So it should have some similarity to terebinthina because it's turpentine is also made from a coal tar derivative, a wood tar. So we see irritable temperament, child wants things and then throws them away, dissatisfied, can be very tubercular. I looked at the miasm for creosote. It's been placed in the cancer miasm because of its affinity or association with cancers. It's been placed in the tubercular miasm. It's been placed in the syphilitic because there's a lot of ulcers. I do want to share this with you about Didier Grand-Georges, who is a pediatrician, French pediatrician. He's got a very interesting take on materia medica for, let's see, so I go here. So Spirit of Homeopathy, Essential Insights, Grand-Georges. Click on that. And this is what he says about creosote, which is quite interesting. Um, So here's another remedy full of symbolic meaning. Creosote from the Greek, flesh, and suitor, preserver. So flesh preserver. That's what that's what they use creosote for, right? They use it when they apply it onto wood. It helps to preserve it so that insects and other um, bugs don't or animals don't degrade the wood. So it's the essence of beechwood used to preserve meat. It was discovered in Moravia, Latin for death and vita, life. The creosotum child has tooth problems. The teeth come in with cavities. And if you you do a search for creosotum in the teeth chapter, you're going to see a lot of grade threes. And a violent red eruption, erythema, breaks out on the buttocks during teething. So don't forget that. During teething, if they get a skin eruption, um, around the rectum or on the buttocks, and then they fit the temperament and everything, you might really want to consider creosote. The teeth will allow the child to bite, to become aggressive and thus autonomous when they first appear. They are already eaten away from the inside. Creosote prefers to turn aggression inward rather than against another, which is, in fact, fertile ground for the development of severe illnesses such as cancer. It is, for example, a remedy for vaginal cancer. So what he says here is eaten away. So if you want to think of, and when we look at creosote, we look at ulcers, we look at scoriation, how things kind of get peeled away or eaten away. There's a strong, strong indication for this particular remedy. Then I wanted to share, let's see, Quinavantes, just an overview. So then we go here to the genus. And then again, so I'm in the Materia Medica tab. This is the repertory tab that's closed. So I can either backspace or click on the binoculars, Materia Medica, creosotum, and just click on the creosotum and then press enter. And then we see keywords, hemorrhagic, discharges are acrid, corroding, eating away, offensive, malignancies. So synopsis, hemorrhagic diathesis, so there can be bleeding, small wounds bleed profusely, flow passively, brown, dark. Again, the type of blood, when there is a wound that bleeds freely, do we want to know? We want to know, is the blood thin? Is it thick? Is it dark? Is it bright red? Because those can all indicate different remedies. This particular rubric, we want to take a look for it. We go to synthesis. So I'm just going to start typing in the chapter. It's under generals. Press enter. Wounds. Bleeding freely. So I'm clicking on it, press enter. And creosote should be here. There it is. It's a grade 2. And if you want to see, there's small wounds, bleed freely, creosotum. And those are the authors. William Boricki, Kent, Farouk Master. So there's a lot of really good homeopaths that have confirmed that creosote has this. So we could do a study on that at a different time. So go back to Gunavantis. Menstrual flow profuse, lying down, aggravated by lying down, better when sitting or walking. That's the opposite of what you normally see. Typically, the menstrual flow is worse, rising, walking, standing, just because of gravity. So this is the opposite, which would make this a little more unique. Discharges are profuse, acrid. In creosote, there's a lot of burning, corrosive excoriation, okay? And then a lot of discharges or ulcers or things, you'll see foul, putrid, offensive, painful dentition, teeth begins to decay as soon as teeth begin to decay as soon as they appear. Hot gums with thirst during dentition, rapidity of effects, rapid decay of teeth, rapid emaciation. It is a big remedy for emaciation. And if you look under emaciated temperaments or emaciated constitutions, creosote is strongly indicated there. Putrid ulcers, putrid diarrhea, severity, very severe, old neuralgias, terrible burning in the chest as if from hot coals. What other remedies have the symptom of hot coals? That's very specific, very unique. You do a search and you type in as from hot coals. I want to look at both of these. We can just use creosote to see where it comes up in the repertoire. And there are going to be other remedies that have that same sensation. So sensation is very important. Hearing about hot coals, pain, burning as from hot coals. Creosote's there. Fatak, belladonna's, apis, arsenicum, carboanimalis. There's a lot of burning in carboanimalis. But there's creosote. Tarantula cubanensis also anguish from burning. And there are some other places you can see. Magnavori has it as well. Abdomen pain, burning. So let me just go back to, we touched on these. Grand George description, Gunavantes. We touched on the Constitution. We touched on the weeping and the deep sleep. So what happened? Oh, let's touch on the differential first. So chloralum was another remedy that was in that rubric. Let me just go back here. Very difficult to wake the child. Belladonna and chlorellum. And in chlorellum, I don't want to spend time going over it, but there tends to be urination towards morning, and then they have a strong desire to be fanned. So kind of that's indication we tend to think of carbo-veg for desires to be fanned, but there are about 50 remedies that have that need for air, wanting a window, not just wanting a window open, but feeling air hunger, like they need air. Um, so chlorellum is there. Belladonna will have night terrors with the bedwetting, bedwetting during the daytime only, while dreaming of urinating, from sneezing, standing. These are all involuntary urination: sneezing, standing, motion, walking. Then there's also belladonna with paralysis of the lower limbs, involuntary urination. So just a couple remedies to consider. And then the follow-up. So 3 weeks after the creosote, 200C, 5 pellets once a day for 2 days. This was reported from the dad. Lots of change. So instead of every night, one incident and bedwetting per week for the last 3 weeks. So 3 times, right? Less moody, seems to be happier in general. Overall, about 80% improvement, 3 weeks. One of the things that we want to see, had the father reported to me, oh, the first week was amazing. He didn't wet the bed at all. How's his mood? It's about the same. And then in the last 2 weeks, oh, he's been bedwetting 3, 4, 5 times a week. That's probably not the right remedy. Typical response for something chronic like this, you give the remedy. There can be an aggravation. There was 200C given once per day for 2 days, but slow, gradual improvement. The fact that 3 weeks later he's still wetting the bed once a week is okay. This is a chronic complaint. He's had this for most of his whole life. So we wait. We don't do anything. So we followed up 6 weeks later, 2 bedwetting incidents in the last 6 weeks. So we still see slow and gradual. So we just wait. In a very good mood, sleeps through the night, no incidents of respiratory inflammation or coughs. This was during the summer, so I wasn't really expecting much, or I wasn't going to use the fact that he didn't cough as part of to get the idea that the remedy's curing his case. I would look more for it when there's more, when it's colder and wet weather. Then follow up every 8 to 12 weeks over the year, showed complete resolution of the bedwetting, and no return of recurrent or chronic cough. So that was a couple of years ago, almost. We're coming up on 2 years, and things have been going well. And I have not heard from the dad since. So they were very, very happy when we discontinued treatment. So you do get to a point with a case like this when the follow-up is 10 minutes because there's nothing to talk about. That's usually when you discontinue treatment. So anyway, I hope you enjoyed the case. If you have any questions, let me know. I will be presenting another case next month, and I am touching on one more. I'm covering one more bedwetting case in this series of 3 presentations. So thank you so much, and take care.